Welcome to the Pathophysiology Important University Questions video, presented by PharmaXene, where knowledge meets innovation. Let's review the weightage of marks for each unit in this subject. Unit 1 and 2 both carry 21 marks. Unit 3 has 22 marks. Unit 4 accounts for 16 marks, and Unit 5 is worth 15 marks. We will begin by discussing the long essay questions, which are typically worth 10 marks each. For cell injury and inflammation, common 10-mark questions include explaining reversible and irreversible cell injury, various cellular adaptations, and the cellular and vascular events in acute inflammation. In the CVS and respiratory section, 10-mark questions often cover atherosclerosis pathogenesis, essential hypertension, congestive cardiac failure, angina pectoris, and the etiology and pathogenesis of asthma. Moving to CNS, endocrine, and GIT, expect 10-mark questions on the pathogenesis of stroke, Parkinsonism, Alzheimer's disease, epilepsy classification, diabetes mellitus, and peptic ulcers. Next, we will examine the short essay questions, which are generally worth 5 marks. For cell injury and inflammation, 5-mark questions include chronic inflammation pathogenesis, chemical mediators, healing by primary intention, intracellular accumulations, free radical injury, and plasma-derived mediators. Continuing with cell injury and inflammation, 5-mark questions also cover phagocytosis, healing by secondary intention, and the physiological and pathological significance of prostaglandins. In CVS and respiratory, 5-mark questions involve asthma pathogenesis, differentiating intrinsic and extrinsic asthma, COPD, hypertension, atherosclerosis, myocardial infarction morphology, and ischemic heart disease risk factors. For the nervous system, 5-mark questions typically address depression and mania, Parkinsonism, pathogenesis, schizophrenia, and cerebrovascular disease, including stroke pathogenesis. In renal, GIT, and liver, 5-mark questions include acute renal failure, alcoholic liver disease, inflammatory bowel disease, jaundice, hepatitis, and the pathogenesis of hepatitis B. For infectious diseases, common 5-mark questions are on the etiology and pathogenesis of typhoid, AIDS, leprosy, and tuberculosis. Further 5-mark questions on infectious diseases cover sexually transmitted diseases, the pathogenesis of leprosy and syphilis, and details about syphilis's causative agent and transmission. In other pathologies, 5-mark questions address rheumatoid arthritis, gout pathogenesis, goitre, metastasis, and the molecular and chemical mechanisms of cancer. Now let's move on to short answers, which are typically 2-mark questions. For cell injury and inflammation, 2-mark questions include differentiating apoptosis and necrosis, factors affecting wound healing, cardinal signs of inflammation, ischemia and hypoxia, transudate and exudate, autocoids in inflammation, metaplasia and dysplasia, and wound healing complications. In anemia and renal, 2-mark questions cover causes of acute renal failure, definitions of various anemias, chronic renal failure pathophysiology, hemophilia, hereditary acquired anemia, and the role of vitamin B12 and folic acid in anemia. For endocrine and metabolic topics, 2-mark questions include hyperthyroidism symptoms, diabetes mellitus complications, acidosis and alkalosis, electrolyte imbalance, goitre, cretinism and myxoedema, and hypogonadism and gynecomastia. In nervous, GIT, and liver, 2-mark questions address Alzheimer's signs, inflammatory bowel disease, stroke and its etiology, stages of alcoholic liver disease, hepatitis symptoms, Parkinsonism symptoms, and jaundice. For neoplasia and respiratory, 2-mark questions include benign versus malignant tumors, carcinogens, biologic carcinogenesis, asthma's pathological changes, radiation-induced malignancies, carcinogenicity, chronic bronchitis, and emphysema. In infectious diseases, 2-mark questions cover UTI, gonorrhea, meningitis, typhoid, STDs, leprosy, TB, and AIDS, their causative organisms and symptoms. Further 2-mark questions on infectious diseases include details about UTI, syphilis, meningitis classification, and the causative agents and transmission modes for AIDS and tuberculosis. Thank you for watching. Subscribe to PharmaXene for more important question discussions and study guides.